Health insurance sounds simple until you actually have to choose a plan. PPO, HMO, EPO. They all look similar on paper, but the difference can mean thousands of dollars when you actually need care. Today, we're breaking down PPO versus HMO versus EPO. What they really mean, how they work in real life, and which one is actually best for you. By the end of this video, you'll know exactly which plan fits your lifestyle, budget, and risk tolerance. Let's start with the big picture. Every health insurance plan answers three core questions. Can you choose your own doctor? Do you need referrals to see specialists? And what happens if you go outside the network? PPOs, HMOs, and EPOs answer these questions very differently, and that's where most people get confused. Let's start with the most flexible option. A PPO, or Preferred Provider Organization, is built around freedom. With a PPO, you can see almost any doctor you want. You don't need a primary care physician to approve your visits. You don't need referrals to see specialists. And you can even go outside the network if you're willing to pay more. PPOs are designed for people who value control and convenience. They're great if you travel frequently. They're ideal if you already have doctors you trust. And they're often the best option for people managing ongoing or complex medical conditions. The trade-off is cost. PPOs usually have the highest monthly premiums. They often come with higher deductibles. And out-of-network care can get very expensive very quickly. PPOs work best for people who can afford higher monthly costs in exchange for flexibility and peace of mind. Now let's look at the opposite end of the spectrum. An HMO, or Health Maintenance Organization, is built around structure and cost control. With an HMO, you must choose a primary care physician. That doctor becomes your gatekeeper. If you need a specialist, your primary care doctor has to approve it. No referral usually means no coverage. HMOs also require you to stay within their network. Outside of true emergencies, out-of-network care is not covered. The benefit is affordability. HMOs typically have the lowest monthly premiums. They often have lower deductibles. And costs are more predictable, which makes budgeting easier. HMOs work well for people who are generally healthy, for those who don't see specialists often, and for anyone focused on keeping monthly insurance costs as low as possible. The downside is flexibility. Appointments can take longer to schedule. Referrals add an extra step. And you have far less control over how and where you receive care. Now let's talk about the middle ground. An EPO, or Exclusive Provider Organization, blends elements of both PPOs and HMOs. With an EPO, you don't need a primary care physician. You don't need referrals to see specialists. You can book appointments directly. But there's a strict rule. You must stay in network. Unlike a PPO, EPOs do not cover out-of-network care except in emergencies. EPOs usually cost less than PPOs but more than HMOs. They offer more freedom than an HMO without the higher price of a PPO. EPOs work best for people who live in cities with strong hospital networks. For those who know their doctors are in network, and for people who want flexibility but are comfortable staying within one system, the risk is simple. If you step outside the network, you're paying the full bill. So how do these plans compare side by side? PPOs offer the most flexibility but come with the highest cost. HMOs offer the lowest cost but the least flexibility. EPOs sit in the middle, offering choice within a strict network. There is no universally best plan. There is only the best plan for your situation. Here's a simple way to decide. Choose a PPO if you want maximum freedom, travel often, or need frequent specialist care. Choose an HMO if you're healthy, budget-focused, and comfortable with one primary doctor managing your care. Choose an EPO if you want specialist access without referrals and you're confident you'll stay in network. The biggest mistake people make is choosing a plan based only on the monthly premium. Health insurance isn't about what you pay when nothing happens. It's about what happens when something does. Your health plan is a financial risk management tool. Read the network. Check your doctors. Understand the rules before you need care. Because the worst time to learn how your health plan works is when you're sitting in a hospital bed. If this video helped you understand your options, consider subscribing for more clear, practical explanations that help you make smarter decisions. Thanks for watching, and I'll see you in the next one.